Hello guys, in this video we are going to study about gastroschisis versus omphalocele, right? These two are very important things that you actually need to know. Extremely important topic from both surgery and pediatrics, right? So you have to learn about these two topics very nicely. Many a times questions are asked in examination like, which of the following is not seen in omphalocele, which of the following is not true about gastroschisis, which of the following is a feature of gastroschisis, which of the following is odd or not for omphalocele, right? So you have to remember this whole table, and you also need to identify that which one is omphalocele and which one is gastroschisis, right? So first, you can see over here in this image, right? First of all, let me tell you what is the difference between omphalocele and gastroschisis. The word omphalocele, here you can see the word seal, right? Seal means covering. So in this particular defect, both omphalocele and gastroschisis are actually anterior wall defects of the abdomen, and from these anterior wall defects the intestine actually come out, right? But in omphalocele there is a covering present, and in gastroschisis there is no covering, right? So this is the basic difference between these two things, omphalocele and gastroschisis. So in the first video we can see over here that in this particular video, in this particular photo, you can see that intestines are actually coming out, right? Intestines are actually coming out, okay? Intestines are coming out, and you can see that there is a covering, right? Covering is present, right? So this is actually omphalocele, right? So this is actually omphalocele. Next, you can see this is a real photo. You can see this is a sac, and these are intestinal contents. So it is again omphalocele, right? Next, this is an ultrasound image of omphalocele, right? Omphalocele baby inside a womb, right? Prenatal. Now this particular image, this is the covering, so it is omphalocele, right? This is omphalocele, right? Next image, see there is no covering. Is there is any covering? No. So covering absent. So it is gastroschisis, right? So this is gastroschisis. Next, again, right, no covering of the membrane, right? No covering membrane. So it is gastroschisis. Also lateral to the umbilicus, often right. It is a very important thing that gastroschisis is generally present lateral to the umbilicus. The opening is present lateral to umbilicus, and in which side, left or right? It is mostly present at the right side, right? See on gastroschisis, like gastroschisis, very easy. Okay, so by this time you must be very expert in identifying these two things or differentiating these two things in image. But now we have to read the theory, right? What is the difference between omphalocele and gastroschisis, right? First of all, which one of the following, which of these two are actually is actually a more severe disease? Let me tell you that the more severe disease is actually gastroschisis, but there is a catch in this particular thing. I'm telling you, I will tell you later. The more severe disease is actually gastroschisis. Okay, first of all, why gastroschisis is a severe disease? See, because there is no covering. Since there is no covering, so there is no protection to intestines, and if the protection to intestine is not present because of lack of covering, so it will come directly, the intestine will come directly in contact with air and external environment. This will cause necrosis, and ultimately you have to remove the intestinal parts, not the whole one, of course. We have to remove a bit, right? So because of lack of covering, gastroschisis is a more severe disease, right? So sac is never present, right? When what is the actual age, what is the common age of gastroschisis? It is prematurity, right? And in relation to umbilical cord, it is present laterally, right? Gastroschisis is present laterally, and it is generally present in the right side, right? Now in gastroschisis, what all contents are present? Small bowel, stomach and colon, but generally these intestinal contents are only present. The very important thing that I want to tell you, in omphalocele you can also get liver. Apart from these things, you can get liver. This is a very bad thing about gastroschisis, right? Okay, again, gastroschisis, it is attached to the sac, right? The umbilical cord, you can see over here, like I told you that in gastroschisis that is present laterally to the umbilical cord, but in omphalocele it is actually attached to the sac, right? The common gestation age for omphalocele is term. It is present generally in term babies, right? Sac is almost always present, but it may be ruptured, but it is not important. It is almost always present, right? Which one of the following is a bigger defect? Of course omphalocele is a bigger defect. That is the reason, because omphalocele is a bigger defect, that is the reason since it is a bigger defect, that is the reason liver actually herniates from it, right? And it is a smaller defect, that's why liver like things never come out of it. Then malrotation is present in both of them, not important. Then bowel characteristics, I already told you, because gastroschisis has no covering, it is directly open to the environment, it will be inflammatory and edematous, whereas in omphalocele it will be normal. That's why it is a less severe disease, right? Now, in omphalocele, it is, since covering is present, you can give normal enteral nutrition. Again, a good thing about omphalocele. But in enteral nutrition in gastroschisis has to be delayed. Why? Because the gut is actually inflammatory and edematous and necrotic sometimes. So you have to actually cut, you have to do operation and then re-anastomose, and then after some few weeks or months, you can start enteral feed. Now, there is a catch I already told you, right? The catch is, overall, more severe disease is actually omphalocele. Why? First reason. First reason is herniation of liver. Already told you, herniation of liver. It will damage the liver. Second reason, actually liver, not actually liver is not the main cause. The bigger problem of this particular thing about omphalocele is that associated abnormalities are more common in omphalocele, whereas in gastroschisis the associated abnormalities are less common, which means that omphalocele is associated with other congenital problems, right? Omphalocele doesn't come alone. Omphalocele brings along many few other congenital defects with it, whereas gastroschisis is a solitary defect. Gastroschisis is a solitary defect. It will come alone, although it will cause the necrosis of the gut because of lack of covering, but that is the only problem, right? And also the defect size is small. That's why gastroschisis overall is a lesser or a less severe problem, right? So this is the difference between omphalocele and gastroschisis. If you remember this particular topic, it is very easy and extremely important. You have to remember this particular USG, extremely important. You cannot leave it. INICET has asked this particular photo from omphalocele. Thank you.